a great opportunity at AUSN to connect with our membership and answer the questions that you have about healthcare, benefits, retirement, and anything else that's important to you. Today we're going to be discussing Tricare with Captain Marylynn Marrese. Captain Marrese last served as the Medical Corps Reserve Affairs Officer, Bureau of Medicine and Surgery. She has been the Director of Service and Member and Veteran Resource Department at AUSN for the past 4 years. We'll be taking questions on Tricare that were submitted beforehand and through live chat. But before that, I'd like to invite Captain Marrese to provide a brief overview of Tricare and where it stands today.
Thank you so much, Kate. It's a pleasure to be here, everybody. Hope everyone's having a fine Navy day. Let me first explain the pattern of Tricare from when you are still CELRES, a drilling reservist, all the way to the point of being over 65 years of age. If you are still CELRES, which means you're drilling, and you are not a federal employee, you are eligible for Tricare Reserve Select, which mirrors what the active duty have with Tricare Select. You and your dependents can sign up for this. However, you have to know that you'll be paying monthly premium. This plan, TRS, is not mandatory if you have other health insurance, but it is often a better deal than your employer's health insurance, and you are allowed to enroll. Now, once you stop drilling, but you're not over the age of 60, and sometimes we call this gray area retirement, and again, you're not a federal employee, you may enroll in Tricare Retired Reserve, which also follows Tricare Select. The sponsor, which is us usually, must be under age 60. You can enroll yourself and your dependents, and again, you're going to pay a monthly premium, but also deductibles. It is not a mandatory program. You do not have to pay for Tricare Retired Reserve. Again, it is if you would rather have a Tricare sponsored health insurance plan. I am going to preface all of this now with warning you that once you stopped being CELRES and stopped drilling, they confiscated your CAC ID card. That means you can no longer log on to many of the things you were happily logging on to, including Tricare. So please be sure before you fully leave, whether gray area retirement or full retirement, that you obtain what we call a DS Logon ID. That will enable you to still access Tricare, the VA, many other websites that you used to access with your CAC ID that you will no longer have access to unless you have this DS Logon ID. Just Google that and it'll bring you right to how to obtain that. Now say you're officially retired, and by official I mean you sure as heck better be getting your pay and all of your PERS documents are in the system, and DFAS, which is our payment system, has you in there as retired. Once that has happened, please make sure that you have a retired ID card. A lot of people, for whatever reason, forget to do this. On your retired ID, it will clearly say that you're eligible for health care. So it's very important that all your information in DEERS be current when you are ready to retire and when you have processed all of that. Your dependents are still in that system in DEERS, so make sure those people are also have all of their current information in there. When you have early retired with pay at age 60, you are not yet officially retired, so I want to mention that as well. A lot of times we think because we're getting pay, and this is if you did a lot of active duty time, they will sometimes retire you before the age of 60. You are still not eligible for certain things. So during that time period, you're not fully retired. I'm talking about over age 60, fully retired. Once this happens and you have the right ID card, you can actually enroll in Tricare Prime, which is like an HMO. You will be assigned a PCM, which is a primary care manager. And this program, Tricare Prime, really only works well for retirees who reside near a military treatment facility. So most of us would prefer to go into Tricare Select. But annual enrollment in this Tricare Prime does have a fee, and there will be copays. It is not free. So, say you don't want Tricare Prime, you have your retired ID, you're over age 60. You can and probably will select Tricare Select, where you can get your care from any provider that's authorized by Tricare within their network. And they have a very large network. When you sign up for Tricare Select between the ages of 60 and 65, you will cost share and there will be deductibles. Okay, you've made it to age 65. Guess what? You must enroll in Medicare Part A, but you also, in order to get Tricare for Life, you must enroll in Medicare Part B. Why? Because remember, all of this is federal. So Medicare will pay your costs first, always, before Tricare. Say you have signed up at age 65 for both parts of Medicare. You're in Tricare for Life. There really isn't much you'll have to do once you turn 65 if you've already been getting Tricare. Pretty much it's automatic, but you should always check by going to your Tricare office or doing anything online that will make sure that you have transitioned. So you have all of that, and you have Tricare for Life. Remember, Medicare will pay first, then Tricare. Say you decided, great, I want to keep my employer-sponsored health insurance plan as well. You can do that, but here's what will happen. Medicare will pay first because you're over 65. Your other health insurance pays second, and Tricare picks up whatever's left. The only time in any situation Tricare is number one in payer is when you are living overseas. Regardless of what your age is, they will pay first because of the overseas situation.
Well, that was very informative and a very broad overview. That's great. So we had a few questions that were sent in. If do you have anything else you'd like to add?
No, not at this time. I'm sure we're going to get more questions.
Okay. One of our questions was, what is the Tricare TAMP program? The Transition Assistant Management Program.
This Transitional Assistance Management Program is not often utilized by those of us who were reservists because it generally only occurs if you are recently coming off active duty and you have no other health coverage. What it does is it gives you 180 days of premium-free, I repeat, no cost, transitional health benefits through Tricare. So say you were called up for active duty for a period of more than 30 days, and it has to be an actual deployment or mobilization. You can't just go on 30 days of extended ADT and get this. But say you were actually called up, you would be offered this. And if you don't have any other coverage, it's a very good deal.
That's fabulous. Good to know. Another question we had sent in, this is from Groton, Connecticut. I am a gray area reservist, and because I was mobilized on a few different occasions to serve in Iraq and Afghanistan, I can actually start drawing my military retired pay at age 58 and a half. Am I eligible to sign up for Tricare Prime as a military retiree?
Because you have retired early just for pay purposes, you have to be very careful as to what this implies. You would probably not get Tricare Prime unless you wished to pay for it. So you would have to enroll in Tricare Retired Reserve because you're in that before age 60 period of time. So you will be paying premiums if you do this. Once you get past age 60, then you can opt for payment as well in either Prime or Select. But just because you're getting your pay early doesn't mean you are retired. So your ID card will still be that gray area ID card, not a retired ID.
Interesting. Here's another one. It says, I am traveling to Europe soon. In the event I become ill, will my Medicare and Tricare for Life cover any medical expenses?
Again, when you're OCONUS, which is overseas, instead of INCONUS, which is in the continental US, Tricare is first. Only when you're you're overseas. Medicare will not be involved at that time. So for the time period that you are still overseas and you need care, whether it's emergency care or regular care, then Tricare pays first.
Are there specific facilities that they have to go to?
No, they don't anticipate that you would have to get yourself to a military base that's overseas.
Mm-hmm.
You would be able to work with them to any facility you had to go to for your care, and that would be similar to using Tricare Select, but it's an overseas plan. You can sign up for it online before you go overseas.
Okay, great. All right, we have. This question was from Kieran Alexandria. It says, if you have kids spread across the country, how can you make sure that everyone gets their Tricare benefits, saying you have kids in college in different states?
Okay. Before college age, wherever the child is living, if they do not have to reside with you, they should be covered through DEERS. Again, DEERS is the answer to your dependence issues. Make sure that they're in there properly. If their address is different from yours, you can put that in there. All of this is self-service once you get your DS log on, so you can fix anything. You could have a child that's in Ohio, a child that's in New York, and another one in Florida. It doesn't really matter as long as they are eligible in DEERS, and then they would have their own ID card to get care wherever they happen to be. After the age of 18, if they're in college, again, they're fully covered that way. Between the ages of 21 and 26, you or they would be paying for a program to cover them, but they could still be covered similarly.
All right, here's another one. Military retirees who paid annual Tricare Prime enrollment fees in 2018 or 2019 could get a refund check due to the recent reforms. What do retirees need to do to see that they are eligible?
Your best bet is if you live near a Tricare office, which is almost always in a military treatment facility. They always have a Tricare office. You just go there and they'll look you up and see. Otherwise, you'd have to call or email to see if you are eligible. It's very unlikely that Tricare will simply mail you a refund check if you haven't asked. Maybe eventually they will, but if you want it sooner, I suggest you call them or go to a site.
The Tricare Young Adult Program is making some changes to make paying premiums easier. Can you talk about that?
This is the program that I mentioned, that if your child is out of college or still in college, they're between the ages of 21 and 26, and you want them covered, yes, they can be covered, but someone pays. Either the child pays or you do, or both. But someone has to open up the account with Tricare under the Tricare Young Adult Program. And once you do that, the new changes are that you can do the payments through allotment. In the past, it got a little cagey. You had to either have your dependent child pay them with a check, and now it can be done out of your retired pay or through an allotment with your child's bank account. So that's big news. Also, they're going to notify, they apparently weren't notifying people 30 days in advance of price increases. Apparently, they're going to do that now.
Oh, that's good. Because I know that you got to keep that budget just right.
That's right.
Tricare waives referrals because, this is from down south. Tricare waives referrals because of Hurricane Dorian. Who is affected by that?
Hurricane Dorian is now gone from the coast of the eastern seaboard of the U.S. However, any states that are still in a state of disaster would be included in this waiving of referrals. If I were you, I would simply contact Tricare. Remember, we only now in CONUS have 2 regions. We used to have multiple regions, 4, and now we have 2. So that would be Tricare East, and that's run by Humana. Just contact them and say, look, I live in South Carolina and we're devastated here. I need to just get care. And I'm sure that until the time comes that the governor of that state or however else it's done declares that there's no longer an emergency, you would still get the waived referrals.
All right, great. Oh, this is a good one. because everything's different now. What kind of dental programs are available through Tricare?
We used to have a Tricare run program called Tricare Retiree Dental Plan. It is gone as of last year. There was an open season where you could then enroll as a retiree. You would be eligible to do that in what they call FedVIP. I know that's going to be confusing. It doesn't say dental anywhere in there, but FedVIP is a federal employee program that allows people to choose various companies that will offer them dental and vision, or one or the other. So if you want dental coverage, that's your option. You must go and sign up for FedVIP, which again is premium based with copayments. So remember, nothing will be free when it comes to dental or vision, not through Tricare. It's a different story if you're a disabled veteran and can use the Veterans Administration hospitals for things. But we're only talking about the usual case of a retired reservist.
All right, well, I think that is all the questions we have thus far. Is there anything else you'd like to touch on that you think is important for people to know?
There are a couple of weird things that we need to know about that a lot of people have asked in the past about. And that has to do with your former spouse or a surviving spouse. Unfortunately, former spouses and surviving spouses cannot purchase Tricare Reserve Select or Tricare Retire Reserve directly. However, if your survivors are enrolled in a federal health insurance program, they are given that option. I have no idea why this is the way the law was written, but right now, neither a former spouse nor a surviving spouse is permitted to just go online or go to a Tricare office and ask for coverage.
Unfortunate.
Yeah.
All right, thank you everyone for joining us today, and stay tuned. Thank you so much, Captain Marrese, for joining us.
Thank you, Kate. It was my pleasure.
We really appreciate your expertise on these issues. Stay tuned for next month. We are going to be holding these webinars every month with different topics. If you have a topic that you would like discussed or an issue that is of interest to you, please reach out to us and email us at membership@ausn.org so that we can find an expert to address all of your concerns. All right, thank you and have a good day.